one of my favorite topics. Lord, you made us. We are embodied souls. We are people made in your image to glorify you. Would you lead us in this class as we talk about ways that you can work your redemption in us through your word, through your people, but also, Lord, through approaches and techniques that are available out there that can be helpful to us, so that we can be healed people that are doing the ministry of reconciliation together. We pray for those things. We pray for wisdom as we talk about this topic, and pray for this class. In Jesus' name, amen. Okay, so we're almost at the end. Week 5 out of 6. We left the harder topics to the end. And they're not harder in the sense that they're harder to teach necessarily, but I would say that in church, this is usually the topics that are less talked about, or that people have more of a taboo, or what's the other word, stigma towards. So we want to make sure that we had set up the ground before we came to talk about it. Last week, we did a big review of the theological points, the biblical points that support our standpoint. Today, we will be referring to some of them today and next week. But if you missed last week, or if you missed any of the other, ground setting classes, please go back. All the classes are being recorded. You can access it at the church's YouTube channel. Okay, so the topic of today is therapy. My name is Lindsay Luciano. I am an occupational therapist specialist in mental health with children. I was hired to do the job of a children's director 5 years ago. I absolutely love it, especially because I'm still working with children, but on a different scale. And I get to work alongside parents and do a little bit of both. And it's just very interesting how much of what I've done in my secular career has been helpful in my religious career, especially my experience with therapy. So let's start with a definition. What is therapy? If I say therapy, what do you think about? Give me something. A treatment. A couch. You like the images that I put up there? What else? Therapy. Support. 101. Walking is my therapy. Anyone saw that one? It's expensive. Although my copay is $30. Does talk insure friend count? So the broader definition of therapy, or the word definition of therapy, comes from the Greek word therapein, the old Greek word, which does mean to minister to someone, to treat. Eventually, that word developed to the word that's mostly known, therapia, and therapia from the Latin, which means healing. So it's every time a professional, I would say, it's a trained professional's attempt at remediation of a problem. So you would have an occupational therapist that can work with your, whatever you do, your occupations. They can help you at work, they can help a child with play. You have a physical therapist that works with your physical body, right? You have a speech therapist that helps with speech. And you have a psychologist or counselor or therapist in that sense who do, in this sense, mental health therapy, right? So anything that helps relieve or heal the disorder can be considered therapy. In that sense, we've been talking about how all of us, even though not all of us will have a mental illness, all of us will struggle, right? Anyone here never had a hard emotion to deal with? Okay. At one time in your life, no matter if you were young or if you were older, at some point, you experience something that just feels really hard hard to carry along, and you feel hurt. So you will pursue some sort of healing, some sort of support or treatment. But I think we are in a place in our culture, and that's the quote that I put up here, that therapy is something that is so talked about, right? Mental health is so talked about, and it's a fantastic thing, and I'm very thankful that we are in this place where we're all talking about mental health, and we're all talking about being well and having skills to deal with the hard things. But it worries me that sometimes this can create a pressure that something needs to be wrong with me and I need to be going to therapy, some sort of therapy. So I'm going to answer this question in two ways, okay? The first one is, there are people that have a significant impairment in functioning, which is one of the criteria used to give someone a diagnosis. They have to have a significant impairment in functioning, which could be they're unable to perform at work, or they're not able to do their daily activities, like getting out of bed, or they have damaging personal relationships. These people will definitely benefit from therapy, from help healing. And everyone in a certain sense can benefit from a purposeful therapy to gain insight, to gain coping skills, to even prevent something that is right now a situation. For example, you just lost someone, right? We have grief shared here at the church. Being part of a group like that and getting support early on can be really helpful in developing skills to deal with the hard situation. So you can benefit from it. But I want to put a caveat here. Therapy is helpful as long as there's movement forward. Do you understand what that means? If there's growth, if there's purpose, if you're going in a direction. So sometimes, if I'm saying that everyone needs therapy, in the sense that everyone needs therapy always, everyone needs to be seeing a therapist every week, is everyone growing every week? Is the therapy being helpful to everyone in the stage of life they are, in the situation that they are? So I think the biggest answer to does everyone need therapy, for me would be not necessarily. Can you benefit from specific purposeful therapy for the reason, for the season? Yes. For a mental illness? Yes. Does everyone needs to be going to therapy all the time? Not necessarily. And you may be going to a therapist and you're doing your thing and going to the therapies because I have a problem and I need support, but there's no movement forward. That work with a therapist, or that work with that technique, or that specific approach, it's not working. There's no movement. That means it's time to switch. Maybe try something different, a different approach, a different technique, maybe take a break, see how you're doing on your own without a supportive therapist. So then we go to our third question. When to seek therapy? And I want to ask Andrew to help me answer that one. Because he was the one that taught me this.
Well, I showed you the page in the book.
Kind of the same thing.
I don't know if you're like me, but like when you're reading a book and you see a very helpful diagram, you're like, oh yes, this is great. And so, my house is filled with pictures of this. So basically, the question that we want to address is when to seek therapy. So the short answer is, if you are facing significant impairment or problems across these areas. So you might, this sort of represents the totality of our being. So in some of these areas, we might rank ourselves as having mild problems. Resource stewardship, we have a bill we don't know how to play. That's a mild problem, okay? But in other areas, we might be experiencing more severe problems. We have highly conflicted relationships with family members or in a marriage. We have emotions that are becoming unmanageable, right? So the point is that the time to seek therapy is when these problems sort of leave the mild and manageable realm to becoming more moderate to severe. And quite frankly, in all the years that I was hoping that people would come to see me for therapy, which is, I'm doing great, which is why I'm here today, to just tell you how good my life. anytime someone reaches out to a therapist, it's usually because they've gotten to the point in which they no longer have the resources to manage whatever it is that they are going through. Now, how do you determine that? It's subjective. It's subjective. It's the same reason why you call your primary care out of the blue outside of an annual exam, right? Which is there's something going on that you're trying to deal with that you no longer know how to deal with on your own. That's why you reach out for help. Same principle for reaching out for a therapist.
So this is kind of a way to think about it. I would say the closest you are to this side, you probably should be, or someone should be helping you find therapy. If you're on that side, you're more on the therapy can help me deal with something and prevent or protect me from developing something worse. So if I'm practicing my self-care, we talked about self-care in our second class, I have good skills to deal with emotions. I have a good support team. We were talking about the importance of community last week. I have access to resources, which I was saying, like my copay is $30. It's a lot easier for me to access a therapist versus someone that doesn't have health insurance and has to pay $120 a session, right? I'm giving you a normal price, not an expensive therapist. But then, if you have someone that is unable to perform without support, or you're having difficulty processing or executing a task, your self-care is deeply affected. You don't know where to start, or you don't have resources to start. Like, all of that is going to affect how and when you seek therapy, right? There are lots of things out there that can help you. And there's a variety of things that can be done. I want to share something. I'm in children's ministry. I work with kids, so I want to share something with you. It can be helpful to you too. When we're talking about what you're able to do, a lot of it comes from what have you learned. Have you learned to deal with things? So I have this, which I print out and I give to parents whenever I counsel or work with a child that is going through something. It's identify your feeling, then figure out what to do. And I would say that a lot of us are adults who have never heard that, who have never learned to identify our emotions. Okay, and remember the wheel that I showed the other week, the emotion wheel? You say, I'm angry. Okay, what does angry mean? I'm angry because I'm frustrated, or I'm angry because I've been hit in the face by my brother, right? Or I'm angry because someone was very offensive to me at work, or there's a lot of reasons for that. So the earliest we can start teaching kids coping skills, the better they are prepared once they face something, they can go back and say, you know what? I know how to seek resources. I have some coping skills. Actually, there's this situation that I don't feel like I have the coping skills that I need. I need support. Does someone in my circle, my community, has the coping skills that they can help me with the coping skills? Do I need to join a support group to learn how to gain skills to deal with that? Do I actually need more than that? Do I need other types of resources? So this is very helpful. I'll be attaching this to the email I'm sending this week. Especially if you have kids, this is really helpful. Helping them figure out what are they feeling, and then this is a kid scale, okay? But it can be helpful to you because I use that to myself too. And I'm not a child anymore, most of the time. So I feel like it's important to have boundaries and guidelines to for kids, for yourself. Okay, this is how I do things. This is how I act here. But I think sometimes we have the boundaries, or we place a boundary for a child or a teen. We give them guidelines. They don't know how to recognize or act on their emotions. They don't know how to deal with it. Sometimes we have good boundaries, like we'll tell ourselves, I'm not gonna look at porn. But then, every time you're angry, or every time you're bored, or every time you look at porn, because you haven't learned to identify your emotion that is triggering that behavior, So you find a way to break through the whatever firewall I will watch on a computer. Or I am not going to stuff my face with sweets because I cannot gain another pound. Well, I kind of can gain a pound right now, but you know what I mean. I can gain another pound, not stuff my face with sweets, but then I get the news that I have a friend dying. And then I've always self-soothed with sweets. If I don't have the coping skills to deal with that, right? If I don't even understand what I'm feeling, you're gonna react, you're not gonna act. So identifying your emotions, which is something we mentioned last week, and figuring out coping skills is an important thing. We can help our kids or grandkids do that, but we also have to learn to do it ourselves. And who can help us? Well, God's word is a fantastic way, but it's not the only way available to help us. So let's work through this. You need to help me with some of this because you know that better than I do. I want to give you guys a couple modes of therapy so you can understand the varieties. But also I want to give you guys some techniques and approaches that are common. A lot of when I say what is therapy, a lot of you guys thought more about the one-on-one, right? Sitting with a psychologist or a Christian counselor in an office and talking for 45 minutes an hour. But therapy is much more than that, right? Therapy can be individual, therapy can be in group. So it can be the one-on-one, or it can be a group support. And that group could be, for example, family therapy, where the family comes together, you have one or two professionals that help the family. Or it could be peers, people that are going through the same thing. Remember when I mentioned like hearing voices groups, or grief shared groups, or divorce groups, so people going through the same thing. It could be religious, so a lot of people that are going through addiction, many churches have something called Celebrate Recovery, which is clearly biblical and like it's a religious type of substance abuse support, substance abuse treatment support. You don't support the abuse, you know, to support the treatment. But you can also have secular, right? You have AA, you have inpatient and outpatient treatments for substance abuse. And you also have the one-on-one. You can find a Christian counselor, or you can just get a psychologist, right? It could be activity-based, right? Lots of my patients, especially being children, most of what we did was what? What do kids do? They play. We did a lot of play therapy. We did art therapy. Let's color together. Let's play something together. Let's figure out what's going on. Activity-based. I'm going to ask Andrew to help me because I don't know how things work in the States because I've never done that in the States, but can you help us understand the inpatient, outpatient, and levels of...
Yeah, it's, in a sense, again, modern therapy is based on a disease treatment model, the same thing in the medical field. So basically, you ask yourself, when does a person need hospitalization when it comes to a medical condition? Well, when it can't be treated on an outpatient level. Same concept to mental health treatment. Some people, they have substance use problems with particular substances that being on them are very dangerous. So we think of things like street drugs, like cocaine or heroin. If someone is in the frequent use of that, that usually results in a hospitalization. If they have significant mental health distress, they have hallucinations, they're so severely depressed they're not able to attend to the daily life functionings of getting out of bed, clothing themselves, eating, going to work, or they have such severe anxiety that they have thoughts of harming themselves, all that will result in a hospitalization. Why? Because it means that they're not able to be stable outside of an institutional setting. And sometimes that's for a short period of time, and sometimes that's for a longer period of time. But the goal of putting someone in the hospital is to get them back to more or less a normal functioning level. Then after you leave the hospital, everything else is considered outpatient. And that could consist of anything from meeting with a therapist for 1 hour a week up to 25 hours or 30 hours in a group setting. So you want to think of two big categories. There's inpatient, and then everything else is outpatient. If you see a therapist in an office a week, that's considered outpatient. And it all depends. So how long can the outpatient therapy go on for? Now, because of the DSM-5, which I gave you sort of a symptom sheet from the DSM-5 there. Now, because of the DSM-5, you notice that the way that these questions are asked is really on a scale. It's a 0 to 4. And because it's on a scale, it's much less sort of clear and necessary to say, you're going to go for this many sessions. Because again, it's based on the person's experience. So some people might benefit from a short number of sessions, some people may benefit for a longer number of sessions. It's really more fluid than that. While you're looking at this, let me just sort of show you what to get out of this particular sheet. Please don't go around your house interviewing different members and saying, oh, I think you are now. Okay, so as you can see on the left column, all the way to the left, there are 13 domains, and that corresponds to the major diagnosis domains found in the DSM. The first has to do with mood, and particularly, the first couple has to do with mood. The first domain is for depression. Then the second domain has to deal with mania. Third is anxiety. Fourth is like problems with sleeping, somatic issues. Fourth is anxiety. Fifth is somatic issues with the body. Sixth, as you can see, is suicidality, which again, if that is high, that's going to result in hospitalization, etc. So these are the 13 domains, and the more severe you score on this, usually within a time frame of the past 2 weeks, the more likely you are going to need hospitalization to treat those issues. Okay, the higher you typically score, the more likely you need hospitalization. The less highly you score, the less intense the treatment you may need to help address those issues. Any questions on this, what you're looking at? Yeah.
I have a question just about the DSM-5.
Sure.
What's the relationship between DSM-5 and ICD-10, and which is used and when?
So that has to do with medical billing, mostly. It's how you classify it. Both on an the ICD is on an international scale. The DSM is another form of coding and billing to classify the same sorts of disorders. Sometimes what will be listed in one way is going to be cross-listed as something else under that scale. Yeah.
And for example, you have some things that will be covered by insurance that are clear diagnoses that are in the ICD, or things that will be in the DSM but are not in the ICD, International Code of Disorders, Disease. And then the DSM was the diagnosis and statistical manual of mental health. So in that sense, if, for example, if you're having marital problems because of a porn addiction, you can treat the porn addiction, and then they're going to cover your porn addiction treatment because it's considered treatment. There's an ICD code, there's a DSM code, but family therapy is not necessarily covered by insurance. Some insurances do, many of them don't. So that's the helpfulness of having the coding. And I think I have a love and hate relationship with the DSM-5 because it did a couple things. It shortened is that muted? It shortened the period that you needed to access help. So you don't need, for example, to be experiencing something for 3 to 6 months before you look for help. You might be able to access health within 4 weeks, 6 weeks.
Basically, nowadays, if you go into any office, they're going to give you some form of a diagnosis for the sake of insurance purposes.
Yeah.
So that your insurance will cover it if your insurance can be applied.
But it's also a negative thing in that sense because everyone gets a label.
Right.
So for the sake of you being treated, you need a label. So maybe you are experiencing something that you might need support for, but there's no way you can get treatment without
That's right.
a code. So they're going to label you something, and then for some people, receiving that label, it's like life-changing. I am this thing instead of I deal with this thing or I have this thing. That becomes their identity. I am whatever is the problem. So that's why I have a love and hate relationship with the DSM.
Yeah, and it could be something as simple as adjustment disorder. After I left my first job in therapy, I went to see a therapist because I was experiencing anxiety because people were telling me their problems. I'm like, I don't know how to help you. I mean, maybe I shouldn't be in this field. And so I went to go see a therapist, and he said, I have to give you a letter of diagnosis. So now I'm all scared. What is really wrong with me? And I open up, and this is so you can send the bill to insurance, so I don't have to pay a lot of money for therapy. And I open it up, and it says adjustment disorder, which basically means you're going through a life transition and you need
Hard to adjust.
Yeah, right. And so thankfully, that meant that I didn't have to pay for therapy. It was covered by the insurance I was on. Usually, from a practitioner standpoint, we give people the most mild form of the diagnosis so that they're able to just receive reimbursement from the insurance. Because of the issue of if you put a diagnosis on someone, that stays on their chart, and so you have to think about how this person will then be conceptualized if they go then to other treatment providers. But it's really just to have a common classification, and also so that you're not stiff with the bill.
I think it's particularly hard with children. I mean, I work in children and teens mental health for many years, and we would receive so many kids that had a diagnosis of ADHD or ADD that because we were I'm from Brazil, so in Brazil, mental health is state funded. So I was hired by the state to do my job. And every child that receives, and you can get medication for free through the government. So every child that receives medication for free has to come for an evaluation every so often. And then they realized that around 2014, 2015, they realized that the number of kids with medication for ADD and ADHD had tripled. And they're trying to figure out what to do with this. Like, is this the reality? Are there kids, really these amount of kids with diagnosis? Or are we over-diagnosing for the sake of offering treatment for kids that are going through difficult seasons? So then our job that year, 2015 or 2016, was we would receive and we'll do blocks of evaluation of like 30 to 50 children, and we would get them and we would go through many evaluations, and an average for us was that only 3 to 5 of those 50 children that were taking Ritalin, that had an ADD or an ADHD diagnosis, actually had that. But you cannot take a kid that is going through therapy and receiving medication and just tell parents, they don't have a diagnosis, there's nothing they can do about it. So we started working with parents. And then we created a family support group. And we started helping parents through that. And especially, you're talking about public health system. Who is most of the population that is coming? Population that has less resources, right? It's free health system. This is the population that knowingly will have what? More or less coping skills. More or less ability to pursue resources. Less, right? So it's the tendency is that those parents never learn how to deal with hard circumstances. They don't know how to deal with those things. They don't know how to teach their kids. So it becomes this snowball. So in that sense, therapy was really important for them. The child diagnosis was more troublesome than helpful. Does this make sense? So I think there's always a balance that you walk as a therapist or in mental between the I should have put it like here, between diagnosis, treatment, and like how are people going to perceive these person in this situation. So I want to, before we go to the Q&A, which I'm very excited about, because he's going to answer most of it. Well, he tossed on me a bunch of questions before, so I think leave this back. I want to share a couple of the most common therapy approach that you find out there. And I put like 8 or 9 in there. I'm going to just go briefly through them so you can see that there's a variety of things offered out there. The first one, and I think the most common, is called CBT. It's Cognitive Behavioral Therapy. And their goal is to figure out what are you thinking. Let's figure out your thought patterns. Let's change your thought patterns.
So, one second. You have a sheet that samples basically the schema of how to work through a problem under CBT and DBT.
Thank you.
Yep.
Andrew comes with the expert. I use CBT, but I use a lot of ABA because I worked a lot with kids with autism. I use different techniques, some of those, not all of those. And I've been through some of those myself as a person, not a professional. So CBT, it's actually the reason I think CBT works so well. It's because it follows the biblical model of recognize your thought pattern, and figure it out, change the way you think, and therefore you're going to change your behavior. You recognize your behavior, the thought pattern that led you to do that behavior. You change your thought pattern, you change your behavior. Romans 12, anyone? Do not be conformed to this world, but be transformed by renewing of your mind. Ephesians 4, 22 to 24 talks about you have to take off the old man that is, being corrupted. You have to do what? Renew your mind so that you will put on the new man. It's not 4, 22 to 24. So I think that's the reason, and it's very biblical. Although it's not a biblical treatment, or it was not developed by like a Christian person trying to use it in a Christian setting, but the truth is still the same. A person that doesn't know God and doesn't have the help of the Holy Spirit can still benefit like that, because we were all made the same way. And if God is telling us how to do one thing, right? He knows how the body works, he knows how the mind works, he helps us through it. So it's used very effectively for anxiety, depression, trauma, eating disorders. It's one of the most widely used therapies out there. The second, I would say, is DBT. It's called dialectic behavioral therapy. But instead of focusing on the thought patterns, they focus on the emotions. What are the emotions you're feeling? It's kind of related to that scale that I gave you guys, that I showed, or even the little wheel that I shared last week, the wheel of emotions. You figure out how to regulate emotions by figuring out a balance between acceptance, things that I have to accept, and things that I have to change. So dialectical, do you know the concept of dialectics? It's a spiral that goes up, so you go back to the same area, but not on the same level. So you can go back to the situation, but you have gained some insight on it, and you go back to the situation and gain some. Does it make sense? It's a spiral like this, like a tornado kind of thing. So you gain more insight, but you're still working on the same axles. Does it make sense? So this is the idea. It's particularly helpful for mood disorders and eating disorders. EMDR, it's a little, some people think of some way about it, some people don't. It's called eye movement desensitization and reprocessing therapy. It's very helpful for PTSD, but the idea is that they will recall a traumatic event, and then while performing specific eye movements, and then they're going to talk through that specific event that was probably without the specific like eye movement thing, you wouldn't have recalled that traumatic event. Then we have animal-assisted therapy. Has anyone seen animal support animals anywhere? You have both support animals and you have animal-assisted therapy, which is basically bringing animals to hospitals. It's very helpful for PTSD. It helps to have like that consistent support. It's helpful among the elderly to provide comfort and support, especially. Then you have emotion-focused therapy, which is focusing on building awareness of emotions, regulating and solving them. It's used for major depressive disorder, extensively studied for complex trauma. It's very helpful. It also has been recently studied for depression and it's showing good results. Family therapy, we probably all have at some point said, I need family therapy, or my parents need family therapy, or something like that, or my uncle or someone in your family needs family therapy. And the idea is basically that the family therapist works with the family to help them resolve some sort of conflict. Group therapy, I think we developed that more when we talked last week about community, because group therapy, group support is not something that you necessarily need to get a prescription for, right? You can just go to a grief support group, or go to a SA meeting, or AA meeting, or an NA meeting, or whatever kind of situation you're going through. You don't necessarily need a prescription to go there, and most of those groups are free. And then, as I mentioned, with kids, art therapy and play therapy are very helpful, or they're more suitable, especially for preschool and school-age kids. Now, any questions about what we talked about? Go ahead. 2 and 5. Okay, so dialectical behavior therapy is the different methodology. Do you want to help with that one?
So DBT or
would you please stand up so you can show up on the camera? Sorry.
Sonia asked about what's the difference between DBT and emotion-focused therapy. So DBT is much more skill-based. So if you look at the sheet that I gave you, this says CBT, but DBT is the next generation from CBT, but it works with the same way of understanding people's problems. So what DBT will do is, especially on the bottom here where it talks about emotions and body sensations and behavior, is teach you different skills to regulate your body, because when we're distressed, right, we often are breathing much more quickly, we're sort of scattered in our thoughts. So DBT helps people get grounded, and then they learn how to practice a different skill when they experience sort of this triggering event. So it's much more skill-based. Emotion-focused is for couples therapy, where when you sit with your partner or spouse and you're talking about when you say this word, this feeling comes up in me, and because this feeling comes up in me, I respond in this way, and then this person says, because you respond in this way, I'm aware that I start to do this, and I want to do that. So you're learning how to respond to each other's emotions in a healing and reparative way. So it's a cycle you keep revisiting over and over and over again, because you want to know how your behavior is affecting that person in the moment, and so you learn how to do something differently.
Which is why it's so used for couples therapy, trauma therapy. Okay, so this is the first question I have for Andrew. Andrew, can you help me?
Sure.
When should I talk to my pastor, and when should I just call a psychiatrist or a psychologist?
And the answer is yes. It all sort of stems from where you are in relation to the problem. If you are in acute distress and you're not functioning, and it's more of an emergency situation, I'd love to help you in any way that I can, but I'm probably not going to be the first place to be of most help to you immediately, in the sense that you may need to seek hospitalization if things are very, very severe. If things are less severe than that, then you honestly, any place that you start to get help is a good place to start. Because that's sort of the approach of mental health counseling, which is basically Wherever you're willing to first take a step, let's start there. So if you're comfortable reaching out to me or somebody or someone in your small group or someone else on staff, someone like Lindsay, do that, because then from there we can figure out, is this enough to continue, or do they need more support, more resources beyond which the local church can provide?
Mm-hmm.
So anywhere you're willing to start, in
And
most
there's
cases,
also
it's
about the
great.
frequency, because our main job is not to provide consistent counseling. Our main job is to provide support, and support might mean guiding you in your small group or guiding you to a discipler that can work with you through something. We have our list of counselors that we recommend. But a counselor's job is to meet with you with a consistency to help you work through something. So there's also that in terms of what's being needed. How do you find the correct professionals? And I am going to answer that one because I can go back to here. You tell me that you're having a problem with your spouse. You guys can't get on the same page. I might start recommending you to, let's try a mediation conversation with the pastor, right? Let's see with an older, more mature couple at the church. Maybe walking alongside an older, more mature couple can be helpful to you. Maybe a couple, if it's a specific situation, maybe a mediation session with the pastor can be helpful. But if it's an ongoing problem that has longer roots, it might be more helpful for us to say, look, can we choose a family therapist and you guys can work through this? Or can we choose a counselor that does EFT, which is very helpful for interpersonal relationships? But you tell me that your problem is in your vocation. You're having trouble adjusting to the new job, or you don't know where to go. I can help you. How do I know what God wants me to do next? How do I know God's will for my life? After you read a book or two, I'm joking. But like, we can help you, and maybe what you need is a coach. Is someone to help you figure out how to do things in your job, right? Maybe I can connect you with a different person in the church that does something similar, right? We started a small group for medical professionals, where we have older medical professionals supporting younger medical professionals. Like, that's vocational. It's biblical, of course, and it's Christian-based, but it's vocational focused. So does it help to figure out how do I find the good professionals? And I also think you have to think through, is it approved by your insurance? Are you able to pay for it? Should I try to find a cheaper option for you or a closer option to your house? So finding the right professional, it's more than just some people are approved and some people are not. There's a lot of factors. If the only thing I can afford right now is my psychologist, because there's no Christian counselor available for me, or there's nothing I can afford right now, but I can, my insurance is gonna cover, this, or then you go to that, you start to where the resources available sometimes. And then we can, of course, help you. If you were looking for counseling for you, for your child, for, someone in your family, we can help you figure that one out. We have suggestions. Andrew, how do you provide a safe space for people with trauma in here? I'm thinking as someone in the church, okay? And how do I know when to recommend professional help to someone in my group? Let's imagine that I'm a small group attendee or leader, and someone open up to me, and okay, there's only so much I can handle. How do I know what to do?
Yeah, so this goes back to a couple of weeks ago where we said, a good question to ask is how can so it took a lot for you to share this. This is very difficult. I want to be supportive. How can I be supportive of you? It's a good question to ask, because if a person asks and says, what I need is someone to listen to me, or someone to check in on me every once in a while, you have to ask yourself, is this something I think I'm able to do? Is this something that I'm comfortable doing? I sense myself I'm called to do. But if the person starts to identify things that are beyond what you're able to do, for instance, I need someone to really process this sexual trauma that has happened, or I need time to process this domestic incident that happened in my life, then that's at the time where you can say, well, let me help you connect to that next person. Do you have insurance? Can we call for some counselors? Maybe we can call the church to see if they have a seat. And at that point, you're helping them in the way that you're able to. You're holding them by the hand and taking them to the next place where they can get more substantial help.
And I think I want to answer for the place of the person asking the question. I used to work in palliative care, literally, people dying, and providing like end-of-life care for them. I mostly work with the family members. And then on my second year on the job, my grandma had cancer. And she died within 3 months of the diagnosis. Who thinks I would continue on the job? I couldn't. For some people, they probably can go through this and that motivates them. I didn't have any resources to deal with that. I couldn't continue on the job. So I'm talking about like a vocational situation. But maybe if someone comes to you for something and you realize in a different season of my life, I can walk with you I can walk alongside you on this. But right now, I can't. I can't be walking with you alongside this, but I can help you find the resources. So if you are willing to help someone, but you are struggling with something, or you want to help them, but you are struggling with their struggle, if they're your child, your parent, and it's too hard for you to do that, you don't have to be the final answer. There's lots of ways to find resources, and I want to encourage you that guiding them to resources is helping. You don't have to, as a small group leader, as a friend, you don't have to have all the resources. We're right there at the hour, so I want to be respectful, but I want to get to this one. So if you guys give me 2 minutes, we'll get to this one.
Yeah, because this gets at the heart of a lot of Christian people's ambivalence about engaging with therapy. And that's something along the lines of, I've been told to surrender my mental illness to God, and that is the way God is, and that it's a way God is testing my faith. Are they right? Is this a real health issue or just a faith matter? And this goes back to the very first class, which is that it could be both. It could be both. So what I want to say is that if we're tempted to give people sort of reductionistic answers to complex problems, I would encourage you to have a much more open posture to see other ways of trying to understand the problem. Certainly it could be spiritual, but what I'm saying is it could be more than spiritual. So let's be the kind of people that are open to getting as much information as possible, because of common grace, because God has blessed the world, not only with knowledge of Him through revelation of who God is in Jesus, but God has endowed the world, people made in God's image, to come up with ways to understand human psychology, development, treatment, etc. So let's get all the information we can, and then figure out what next steps would be. Because we wouldn't want to miss out on something good that might be found in another resource that we haven't thought of.
Okay, so next week's our last class. We're talking about medication. I'm very thankful for the 3 people that reached out with questions. It really helps us to know what questions. You saw that the whole class was question-based. It really helps us. So email us back. Tomorrow or Tuesday, I'll be sending an email out with the PDF for this, the PDF for the coping skills scale. You can have access to all of the resources. We can send you the church counseling suggestion, like the people that we support for counseling. All of those things will be in your email. Reply back. Reply back to me or reply back to Andrew and say, I have these questions. And it can be about medication, but it can be about anything else, because it's our last class in mental health. So take the time to think, is there anything that I want to know? Is there anything that is at my heart? And no one else needs to know. You can just reply to us, either me or him, whoever you feel more comfortable sending the question to. Or, drop a question in our mailbox so we don't know if it's you, if you really feel uncomfortable with that. But we just want to thank you for being here. We think that part of creating a good community that is supportive is to have an informed community that is willing to provide that support. So thank you so much for being here.